Hello everybody and welcome back. I hope that you all have been doing at least okay right now. I think everybody is feeling a lot of stress and a lot of tension and frustration and anxiety. I know I have a lot. There is a lot happening at once right now. Specifically speaking on the current horrific pandemic that we are living in, I'm sure a lot of you with chronic illnesses are really feeling the anxiety. Anybody that is immunocompromised is stressed out. I would think so. I can really only speak for myself and the people I know that are immunocompromised. It is very scary. And I don't want to start off the video with this, but it relates to the topic that we're talking about today. I'm really terrified of this pandemic, and I want to be really open in saying that. I'm thinking about it constantly. And I right now am mostly working from home, luckily, but I do have to go into the office for some things. And for people that don't really remember, because my job situation's been a little tricky for the last year, I now work in a med spa and a medical office, so we are very, very hyper vigilant about cleaning and making sure everything is sterilized and safe and everyone is protected. The patients that are coming in, which is minimized by a lot because we're only allowing one patient at a time, they have to wear a mask, they have to wash their hands, they have to wipe down their phone. We wipe off and deep clean the room that they're in before and after they're done. You know, I'm at least one person that's trying to do everything I can to minimize my potential spread and protect all of you. And you have my full support, and you are welcome to share your experience with all of this in the comments below, and I will try to reply to as many people as I can. Today we're going to be talking about something that does kind of have to relate to COVID. It's being taken seriously in healthcare and medical situation. First, I just want to briefly share my experience, and it will be brief because luckily for me, I really haven't had many situations where I didn't feel like my voice was heard. And I'm really grateful because I've talked to a lot of my friends and family, particularly a lot of women in my life, and that is not the same story for them. I think there were maybe like 2 times where I went to the nurse or urgent care and I felt like I had strep throat or something really serious, and I was told that I just had allergies and to just take ibuprofen and Benadryl and it would go away. But that is extremely minor in comparison to a lot of the other issues that people are facing. So I feel very grateful. Unfortunately, one person that has a lot of experience with not being taken seriously is my mom. I believe I mentioned in my Hashimoto's story video that my mom was never diagnosed with Hashimoto's until I was. And as many of you probably know, a lot of autoimmune diseases are genetic in some way. They're not always, but usually a lot of people that have autoimmune diseases have a family member that has one too. It might not have to be the same. For example, your grandmother could have rheumatoid arthritis, but you could have celiac, but they're both autoimmune diseases in nature, and that could be a genetic marker in your family. Now, if you haven't seen my Hashimoto's story video, you can go watch it. I'll put a little linky guy up there where I still don't know which way it's gonna be, but it's gonna be in the top corner. I got sick. I started feeling terrible. I immediately knew something was wrong. I didn't know what it was. I WebMD'd my symptoms and it came up as chemical exposure or mold exposure, and I went right to my doctor and she said, okay, yeah, we'll test you for mold and chemical exposure, but I'm gonna test some autoimmune things too because I think some of your symptoms could be that. And it was easy. I mean, the mold was negative, the chemicals were negative, my markers for my thyroid were through the roof, and it was that easy for me. For my mom, she had been feeling symptoms since she was in her late teens, early 20s. And she was told by her doctors that it was hormonal, that it was anxiety, that it was all these different mental health problems or hormonal problems. And now, because research is so advanced, we know that a lot of hormonal problems and mental health problems are caused by autoimmune diseases, very specifically Hashimoto's. So my mom was undiagnosed for over 20 years. Probably more than 20 years. I'm not very good with math, and I'm not going to reveal my mother's age, but for a really long time. And she went on many different medications, anxiety medications, antidepressants to try and help correct her issues, and they never went away. Now, luckily, she doesn't have as many symptoms, so she doesn't need to be on medication, but as soon as I got diagnosed, she was like, what? If you have it, I have to have it. That makes a lot of sense, because in my family, almost everyone has some sort of autoimmune disease. My uncle has MS, and my grandma had rheumatoid arthritis, and I think she had hypothyroidism, which was probably Hashimoto's. And I have cousins and aunts with celiac, with colitis, with all sorts of issues. So it makes sense that she would also have an autoimmune condition, but for some reason, she was never diagnosed. On top of my mom's story, I've also read a lot of your comments telling me your experience with doctors and being misdiagnosed and not being taken seriously. And I've noticed, just from what I can tell, it's not just a specific demographic. Luckily, I have a pretty, diverse audience as far as age goes, and people of all ages are having trouble being taken seriously or being misdiagnosed. It's really heartbreaking. And I've noticed a common theme with my female and female identifying viewers is that your first diagnosis is usually a mental health related issue. And for a lot of you, that's really just putting a band-aid on top of, a wound. It's not getting to the root cause. And there are obviously millions of people who struggle with mental health issues, that struggle with anxiety, that struggle with depression, that struggle with other mental illnesses. But a lot of people have some sort of autoimmune condition or chronic illness that's being misdiagnosed. I've seen some horrible stories about people being sent to really intense therapy because their doctors have told them that it's all in their head and they think it's some sort of psychotic issue. And it really, really makes me angry to hear that. And then later on they get diagnosed with Hashimoto's or another hormonal chronic illness. So really everyone can struggle with not being taken seriously, no matter who you are. But I will say there is a very disproportionate amount of women who are not taken seriously. A lot of the times women's symptoms will be dismissed as emotional distress or psychosomatic, when really a lot of women are really, really, really struggling with something very serious that needs to be treated. And I read an article that had a doctor, Dr. Fiona Gupta, and she was saying, you don't know how many women I see come into my office telling me that they've been shut down by a lot of other doctors because their issues are stress related or, related to either menopause or because of their period, which is just shocking to me. And these aren't just, male doctors. A lot of the time it's doctors that are, very similar in demographic to these women. A lot of them are female doctors. Some of them have kids. And I think that's even more frustrating to have a doctor that's so similar to you and dismiss you so easily. And speaking from my own personal experience, and I'm sure a lot of you share this, you put a lot of trust in your doctors. You're under the assumption that they're there to care for you. They are there to help you get better. You want them to care about you. And I know for a fact, because I work for a doctor, my boss, she bends over backwards for her patients. But she was, for a long period of her career, she was in a more commercial healthcare facility where she was seeing patients very rapidly, and she felt like she didn't really get to know them, and she wasn't able to spend as much time with them as she wanted, and she has really openly admitted that. Another point I wanted to make very quickly is that I talked about how there is a disproportionate amount of women that are not taken seriously as much as men, but I will say that women of color definitely are the group that struggle with this the most. That is something that definitely needs to be addressed. There have been many studies that have shown that a lot of women of color are less likely to receive care, or their care is put off longer. Like in an emergency situation, they're less likely to be cared for than people not of color. I will put some links down below to articles that I've read and some research that's been done on this topic, just so you can have more information. So, what can we do to help ourselves when we are in these situations where we know something is wrong with us and we feel really alone and like we're not being listened to? So here are a few tips I have in my experience that can maybe help you help yourself a little more. Number one is do your own research. You never want to self-diagnose yourself with something because that can cause a lot of problems. And I'm not recommending anyone do what I did because I think it can cause a lot of unnecessary stress and panic. I know there are a lot of jokes like, oh, you search your symptoms into WebMD and they tell you you're dying, and that can definitely happen and you don't really want to do that. But there are some reputable websites and medical journals where you can read more about certain illnesses if you're suspected of having them or you have a family history of them. I'll provide links to the ones that I use down below, but the National Institutes of Health is a great one, as well as the National Health Information Center. You want to make sure that you're going to these types of websites, and you can do your own research too. There are many more that are out there. Those are just the ones that I've seen, and there are specific ones for different conditions as well. But in my case, I did my research. Definitely thought that the chemical and mold exposure was a possibility, but Hashimoto's did come up when I did my search. So I had that in the back of my mind as well as a possibility. And when my doctor recommended the autoimmune panel, my gut said, oh, okay, it's probably that. Another tip I have is to be confident in yourself. Do not downplay your symptoms. Don't say, oh yeah, my throat feels kind of big sometimes, but it's not a big deal. Or, oh yeah, I get really shaky, but I don't know if it has to do with food or it's my period. Don't do that to yourself, please. Write a comprehensive list of your symptoms, whether it's written out or on your phone or something, and come into your appointment with details. When the doctor asks for your symptoms, you say, yes, I've been having severe knuckle pain, I can't sleep, and I haven't been able to sleep for 3 months. I'm getting really bad anxiety over situations that aren't stressful. I have really horrible brain fog, and I'm getting very mentally confused, and this was not an issue before. You have to be very direct and confident in what you're saying, because if you seem unsure, a doctor might be more likely to write you off. And my last tip is to get multiple opinions if you're not confident in your diagnosis. Not to the point where it's concerning, but for example, I got diagnosed by my primary care doctor, and then she recommended an endocrinologist, and I went to an endocrinologist, and then I also went to a gastroenterologist, and then later to a dietitian. And some of them had some conflicting information and conflicting viewpoints, but altogether, all of those doctors helped me find a way to get better. And a lot of primary care doctors aren't specialists in a specific disease. So you really want to make sure if you have the resources, you should go to a specialist in whatever department your issue relates to. Now, these are only tips. These aren't guarantees. This is just what I did for myself, and I had a lot of success. And I know correlation doesn't always equal causation, but I think everyone can agree that by doing these things, they can really only help you in the long run. To all of the doctors out there that are listening to their patients, that are doing the best they can with the resources they have and the time they have, I just want to say thank you, because I know I have had a lot of really great experiences with doctors, some not so great, but overall I feel very supported by my doctors, which is a really good feeling to have. So thank you, because I know there are good ones out there. And then specifically relating to COVID, if you feel terrible, if you feel like you might be developing symptoms and it's getting bad, take care of yourself. It's really hard to know what the right thing to do is, especially right now. My boss is saying if you feel sick, just self-quarantine in case, but if it gets to the point where you need to go to the hospital, you need to get help. It's so scary. This virus is so contagious and life-threatening. So wear a mask, wash your hands, don't touch your face, minimize the times you go out. I'm in California, so I don't really know exactly how it is for other states here or other countries, but I've just noticed that even in California, a lot of different counties are just doing what they want. Even if things start opening back up where you are, please be cautious. If our bars are opening up around you, just wait. It's not worth it right now. You don't want to hurt yourself. You don't want to cause potential harm to yourself or other people around you. If you can continue to support local business in any way you can, do it in a way that's safe, whether that's getting takeout safely or purchasing items online or whatever that may be. But I know it's so difficult, and if you're a business owner that's struggling right now, I understand your pain. I don't completely understand it because I'm not a business owner, but I do work for a small business owner, and the stress that she's under is really immense, so that's not anything to be taken lightly. And lastly, I know we're all under a lot of stress. There's a lot of anxiety. Try your best to be compassionate and treat other people with kindness, and also don't be hard on yourself. You know, we're all in an unprecedented situation. We're probably not at our most ideal selves right now. A lot of my close family and friends have lost their jobs. A lot of people aren't eating as well as they want to, or they're not able to exercise in the way they used to. Just be kind to yourself as much as you can, and staying safe and being as healthy as you can with the resources you have is enough. Before I sign off, I also want to just thank you all for 1,000 subscribers. Before I sign off, I want to thank you all for 1,000 subscribers. You really have no idea how much it means to me, especially since I've been less than ideal with my posting schedule, because, you know, I was in a good state of mind to start a YouTube channel, and then things happen and flare-ups happen and job situations happen and life happens. And those of you that have stuck with me through all that, thank you so much. And I am so appreciative of all of you. I hope you all have a wonderful day, and I will see you next time. Bye.